My name is Dr. Douglas Ayers, and I'm the Chief of Joint Replacements here at Beth Deaconess Medical Center in Boston. We are very happy that you've chosen our medical center to have your joint replacement surgery, as we are fully convinced that your active participation is a key element in having an ideal outcome. And we look forward to having you work closely with our team throughout your stay.
Hi, I'm Aisha Abdeen, one of the joint replacement surgeons here at BIDMC. Thank you for giving us the privilege of performing your surgery. Here at BIDMC, we will ensure that you receive the highest quality of care by everyone on our team.
Hello, I'm Dr. R.G. Davis, a joint replacement surgeon at Beth Deaconess Medical Center. I have a tremendous passion for my work as a surgeon because I know how much the lives of our patients will improve once they recover from surgery. Around here, we never forget you're human first. I look forward to taking care of you and your family.
Hello, I'm Marie Grillo Darcy, a nurse and clinical educator at BIDMC, and I'm here to walk you through the steps you'll need to take and what you can expect before and after your joint replacement surgery. Let's start with what you can do to prepare to come into the hospital. About 2 weeks before your surgery, you will attend a pre-admission testing, or PAT, appointment at BIDMC. At this appointment, you will meet with an anesthesiologist to discuss your home medications and anesthesia options for the surgery. The anesthesiologist will also review which of your home medications are okay to take before the surgery and which ones you should not take. You will be given a bottle of chlorhexidine soap to use at home. Because our bodies aren't sterile, we want them to be as clean as possible before the surgery. Be sure to use this soap the night before and morning of your surgery. The nurse at your PAT appointment will review how to use it. After surgery, every patient receives intravenous therapy or IV antibiotics in order to prevent infection. At your PAT appointment, the nurse will also swab the inside of your nose with a Q-tip to test for an infection called MRSA or MRSA. MRSA is a germ that is found on or in a person's skin, nose, and mucous membranes. If you have MRSA, it can be resistant to certain antibiotics, so you would receive a different type of antibiotic after the surgery, and you may be prescribed an antibiotic ointment and require additional days of chlorhexidine. If you have MRSA, while you are in the hospital, the staff will take extra precautions to prevent the spread of it. You will be placed in a private room, and hospital staff will wear a gown and gloves when taking care of you. Do not eat or drink anything after midnight on the day of your surgery. If you take any medications at home, the anesthesiologist at your PAT appointment will tell you which ones to take the morning of your surgery. It's okay to take these medications with a sip of water. As you think about packing for your hospital stay, remember that you will not need a lot of belongings. While you are in the hospital, you will be wearing a gown for most of your stay. However, when you leave the hospital, you will want to wear loose-fitting clothing, as you will have some swelling in your hip or knee. Some people prefer to bring pajamas, which is fine. I wouldn't recommend anything tight like jeans. Also, be sure to bring shoes that have a backing, like this sneaker. Flip-flops and slippers are not recommended because they are loose and will increase your risk to fall. While you are in the hospital, we do provide these very fashionable slipper socks that have non-slip treads to prevent slipping. Cell phones are okay to use, but don't forget to bring your charger. If you would like to bring a laptop, wireless internet will be available to you. Please do not bring any other valuables into the hospital. There is a safe on the unit where you will be staying after your surgery if you wish to lock up any of your belongings. Please leave your medications at home. If you do bring in your medications, they will be locked in the safe while you are in the hospital. If you have crutches at home, you can bring them in with you on the day of surgery, or have a friend or family member bring them in for you the day after your surgery. This way, the physical therapist can take a look at them to make sure they are a good fit and in good condition. On the day of your surgery, come to the main building on the East Campus at 330 Brookline Avenue. While you are on Brookline Avenue, the road that runs in front of the hospital, look for the sign that says East Campus Main Entrance. When you come in through this entrance, it will take you right to a garage where you can park. Check in at the main information desk in the lobby of the Feldberg building. This is the same building as your PAT appointment. You will be given further instructions once you check in. Your surgery will take a couple of hours, and after surgery, you'll spend a few more hours in the recovery room before moving to your room on 12 Reisman. Visitors are not allowed in the recovery room with you, but they have a waiting area. And prior to your surgery, the nurse in the holding area will take down contact information for your visitors, so the surgeon may call them when the surgery is finished. There are a few things you can expect when you wake up after your surgery. You will have intravenous therapy, or an IV, placed in your arm by the anesthesiologist before your surgery. The IV will stay in place until you are discharged. We use the IV to give you fluid until you can drink on your own, and to give you antibiotics, pain medication, and nausea medication. During surgery, your doctor may put a hemovac drain inside your incision. A hemovac drain is a tube that is connected to a collection device outside of your body. The purpose of a drain is to let the extra blood and fluid around the surgical wound drain so that the incision can heal. Your nurse will monitor the drainage and will empty it as needed. The drain is usually removed the day after your surgery. You will also have a tube inserted into your bladder called a Foley catheter. The Foley catheter's job is to drain the urine from your bladder, and this will be removed 1 to 2 days after your surgery. You may wake up with oxygen tubing in your nose. The oxygen tubing is usually removed once you are wide awake and your oxygen levels are fine. While you are in the hospital, we will have a list of all of your home medications. Your nurse will provide you with these medications. However, there may be some changes, and your nurse may give you some medications that you are not used to taking. For example, you'll be given a multivitamin and vitamin D daily. You will also be given a chewable Tums 3 times daily for the calcium and for your bone health. You will also be given medications for your bowels in order to prevent constipation that can be caused by the pain medication. It's normal to not have a bowel movement for a few days after the surgery, but one medication that helps with this is Colace. Colace is a stool softener that does not cause you to have a bowel movement, but makes it softer so that it's easier to go and you do not have to strain. Senna is a mild laxative that will help you to regain function of your bowels. You'll continue to take these medications at home while you're taking pain medication. I should also note that you may not receive the same medications that you take at home during your hospital stay. For example, some people take medications for high blood pressure. Since it's normal for your blood pressure to be lower immediately after the surgery, we may adjust your home blood pressure medications. When you are discharged from the hospital, you'll be given a list of all your medication instructions. You can expect to have pain at your incision site and joint after surgery. It's also common to be sore in other parts of your body depending on the way you are positioned in the operating room. The experience of pain is different for everyone. Although you will not be pain-free, it is very important to us that your pain is under control. We believe in a team approach to pain management. Your team includes you, your nurse, physical therapist, doctor, nurse practitioner, and physician's assistant. There are major advantages to having good pain management. This includes early ambulation after surgery, getting a greater range of motion in your joint, and improved sleep and well-being. People don't always think about the consequences of poor pain management. This includes poor sleep, anxiety, and an increased risk for pneumonia. Poor pain management can also cause decreased ambulation, mobility, and range of motion in the joint. All of these can cause an increased risk for blood clots and irregular scarring of the incision. So this is something that we take very seriously. You will be frequently asked by your nurse to rate your pain on a number scale from 0 to 10, with 0 being no pain to 10 being the worst pain you've ever had. This will help your nurse know how well your pain is being controlled. If you are not comfortable, tell your nurse right away. Your pain control is very important to us, and we want you to be as comfortable as possible so that you can get up out of bed and moving. One way that we help to control pain is with medication. Narcotics are one type of medication and include medications like oxycodone, hydromorphone or Dilaudid, and morphine. These medications are helpful for the sharper pain that you may be feeling after surgery, particularly with ambulation and exercise. During the night after your surgery, you may have a PCA for pain medication. This stands for patient-controlled analgesia. A narcotic, such as morphine or Dilaudid, is controlled by a pump. You are given a button to press when you are having pain. When you press the button, it will deliver the medication through your IV. This is set up so that it doesn't give you too much medication, as getting too much can make you sleepy. Your nurse will check with you frequently to see how this medication is working. It's very important that you are the only one who can push this button. The PCA may be stopped the morning after surgery. At this point, you will switch to oral narcotics for pain, and this is a nice time to transition to pills because the anesthesia will be wearing off. Oral pain medication also lasts longer and does not wear off as quickly as IV pain medication. This medication will be given as needed, not on a routine schedule. Your nurse will check with you often, but we do not want you to wait in pain. Ask for the medication if you need it. We do recommend taking pain medications before physical therapy sessions and at bedtime. Common side effects of narcotics include constipation, which will be managed with Colace and Senna, drowsiness, which your nurse will monitor, and nausea and vomiting, so you should take medications with food. There are other medications besides narcotics that are helpful for pain control, and they're just as important. This includes Tylenol, which will be given to you around the clock. Tylenol works well with narcotics as it actually increases their effectiveness. Before your surgery, you may have been taking medications such as Aleve, ibuprofen, Advil, or Motrin. These medications can increase your risk of bleeding after the surgery, so they are held post-operatively until your surgeon says it's okay. Over time, you will be able to gradually decrease the narcotics and take Tylenol only. The pain will go away over a period of several weeks or less. Talk with your nurse to plan a schedule that works for you. For example, think about if you want to be woken up for pain medication overnight or not. Medications are not the only option for pain management. Other options work well when used along with medication. These include ice therapy and elevation. Use ice at least 3 to 4 times daily for 20 minutes at a time. Elevation will help decrease swelling and decreases pain and stiffness, especially after knee surgery. Relaxation and slow deep breathing. Distractions like listening to music and looking at photos, perhaps of family or places you've been. And Reiki therapy, which is available most Tuesdays and Thursdays while you're in the hospital. And position changes. You will have an incision about 6 to 8 inches long where your joint was replaced. After the surgery, your incision will be covered with a dressing. The orthopedic team may remove your dressing 2 days after your surgery. You should keep your incision clean and dry at home. You may apply dry sterile gauze as needed for drainage or comfort, but otherwise you may leave it open to air without a dressing as long as there is no drainage. You will be given some dressing supplies before you go home. It will be okay to shower 5 days after your surgery. You may let the soap and water run right over your incision, but do not apply any lotions, creams, or powders. When you get out of the shower, gently pat the incision dry with a clean towel. Do not leave the incision wet. The incision should not soak in water, so this means no tub baths until the incision is completely healed about 4 weeks after the surgery. This also means no hot tubs or swimming. Look at your incision every day for signs of infection. This includes a temperature over 101.4 degrees or an increase in redness, swelling, drainage, or pain. Old bruising is normal. Please call your surgeon if any of these signs occur. Your incision will have staples that will be removed 2 to 3 weeks after your surgery. This will be done either at your follow-up appointment or by the visiting nurse at your home. You will be given a breathing exerciser called an incentive spirometer. After surgery, you may not be able to take deep breaths as you normally would. This will help you to take deep breaths and cough. It's very important to use this 10 times every hour while you are awake to help prevent a lung infection or pneumonia. After surgery, you can eat as soon as you feel ready. You may want to start slow with some liquids and advance slowly to solids. You should drink plenty of fluids. During your stay, there is room service available for meals, and you can order whenever you like. While you are in the hospital, it's very important that you use the nurse call light to call for assistance when getting out of bed. It's important that you do not get up out of bed by yourself because we do not want you to fall. When you ambulate out of bed, we will use a gait belt around your waist. This will help to stabilize you as you walk and transfer. After any surgery, including orthopedic surgery, there is an increased risk of developing a blood clot in your leg. And although the risk is low, it's one that we take very seriously. There are 3 things that we do to help prevent blood clots. Compression stockings are placed on both of your legs. These stockings are snug and help the circulation in your legs so that you do not get a clot. They will stay on for your entire hospital stay. Once you go home, you should continue to wear them for 6 weeks. At home, it's okay for you to take off the stockings at night and when you shower, but you should wear them as much as possible during the day. Compression boots will be placed on your legs. These boots are connected to a pump. Air is pumped in and out of the boots to increase the blood circulation in your legs, starting from the bottom up. These should stay on your legs for your entire hospital stay, both while you are in the bed and while you are sitting up in a chair. Finally, you will be placed on a medication that will thin your blood so that there is less of a risk for clots. If you are already on a blood thinning medication at home, your medication plan for after surgery will be discussed with your surgeon. Otherwise, you will be placed on a medication called enoxaparin or Lovenox. Lovenox is given by injection into your stomach. It's given once per day at home for 4 weeks, which means that you will learn how to give yourself an injection at home, and it's okay for a family member to do the injection. Before you are discharged, you will receive prescriptions for new medications. While you are in the hospital after surgery, you have the option of having your prescriptions filled through a bedside delivery service by Walgreens. This is an optional service, and it's only available if you are being discharged to home, not to rehab. Walgreens bedside service eliminates having to make a trip to the pharmacy on your way home. A Walgreens liaison will meet with you to explain the process. The liaison picks up your prescriptions, fills them, and delivers them to you before you are discharged. You may pay your copay with cash or credit card. You do not have to belong to a Walgreens pharmacy, and there is no discussion or pressure to change to Walgreens. If your prescriptions require refills, you can still get them filled at your own pharmacy. If you choose not to use the Walgreens service, please be sure that you bring your pharmacy's information into the hospital with you. Your nurse will fax your prescriptions to your pharmacy before you go home. Please note that Massachusetts law does not allow for narcotic prescriptions to be faxed to pharmacies. They must be presented in person, and this can be done by a family member or a friend with a valid photo ID. Thank you for taking the time to watch this video. Please do not hesitate to reach out to anyone on your team at BIDMC if you have additional questions or concerns. I wish you the very best with your joint replacement surgery.